So we're going to talk this afternoon for the next hour or so about communication disorders. For some of you, it may be a nice, tidy little review. For others, there may be some new information. Hopefully for everybody, there will be something of value. If you find yourself so excited about this topic and you'd like to know more about it later than today, that's my contact information there, and you can always let me know. Okay, they tell me I have to tell you this, that there's no potential conflict for me being here to talk to you. And then these are hopefully the things that you will feel like you walk away from the next hour from. So hopefully what I can do is tell you a little bit more about communication disorders than perhaps you knew on your way into the room today. And what we're going to do is use the DSM-5 framework in terms of our talking about them. And you'll see that we've set it up in terms of the organization as we go through. What I also want to do is just highlight for people what are some of the red flags or concerns that exist for kids who may have communication disorders. What are the things that people might be looking for that would tip you off that that's something to be considering. And then we'll talk briefly about some of the services and resources that exist for kids with communication disorders. So I work primarily in a pediatric environment, and that's really the lens that I'm going to put on for the next hour or so. I think the reality is that services and supports for kids who have a communication disorder really truly do exist primarily in a pediatric environment, that there's not a lot of services and supports for adults who have developmental disabilities or communication disorders, but we can talk about that if people have specific questions. So just in terms of who I am, I know they said that I work at CPRI and I've been there for the last 15 years, but for anybody who's not familiar with speech-language pathology as a discipline or a field of study, what brings me here today is that I do have my master's degree in communication sciences and disorders, and in getting that I have a number of coursework areas that you can see listed in your handouts. And once I graduated from my program, what that meant is that I am able to work as a regulated health professional. So again, anybody who doesn't have experience with speech-language pathology might want to know that. And we do have a college that oversees both speech-language pathologists and audiologists. In Ontario, we have our own college, and that's done province by province across the country. But what that lets me do is to work as an autonomous professional, really with the role of identifying and supporting kids who have communication disorders, whether that's a communication disorder that stands alone or whether it's a communication disorder, as in my case, that often co-occurs with other developmental disabilities such as autism or intellectual disability. If you want to know more, if you don't know a lot about speech pathology, I have listed the college or the association websites up there. You can certainly learn more. And I threw in audiology for you there too, just because theoretically we work under the same college. And I thought what we could do by starting today was really just talk about the different terms that we use when we talk about communication disorders, because I think in casual conversation and day-to-day interactions, we often use a lot of these terms interchangeably. But the reality is that they actually do mean very different things. And so as a speech-language pathologist, if I get a referral for a speech assessment, I would assume that they're looking for something different than perhaps somebody intended if they were thinking about that more broadly. So just in terms of the next hour, and again, thinking about things as we go through, I just wanted to make sure we were all on the same page, talking about communication and what that is. So communication is really the exchange or the sending of a message back and forth between two different people. So it's any form that we might use to do that, whether that's a verbal method or whether that's a non-verbal method. It could be a behavior that is intentional. It could be a behavior that is non-intentional, but a message goes back and forth about somebody's ideas or somebody's experience. So communication is a very broad term in terms of the exchange of information. And the way that we communicate for most of us is that we use language. And language is one of the different forms that would be available to us for communication. And it is a rule-governed system that we've all adopted, that it includes words that we've decided have specific meanings and rules of grammar that we decide conventionally are the way that that language must be used. And so it's that conventional system which really is based on symbols. So we decide that the word tree means tree because we decided it, right? There's really nothing inherent about a tree that the sounds t or e represent that thing. We just decided that conventionally. And so that's what we're thinking about when we're talking about language. And in a couple minutes, we'll talk about language disorders. And so it's that rule-governed symbol system that we'll be talking about. We're also going to talk about speech difficulties that kids may have when they have communication disorders. And speech is actually that system of making the sounds. So it's the production of the sounds and the combination of the different sounds that go together to create the words that we hear, that auditory signal that we're talking about when we talk about speech. So it's a much more physical component of communication. and it's how we express with language. And language is one of the ways that we communicate. So again, I think it's important to talk about these things in terms of what they truly mean when we're thinking about communication disorders, because if you start thinking about them as being interchangeable terms, you're going to have difficulties thinking about the challenges that do exist potentially for kids who have communication difficulties or disorders. Okay, so like I told you a couple minutes ago, we're going to use the DSM-5 framework to talk about communication disorders. And you'll know from your knowledge of the DSM-5 that under neurodevelopmental disorders, there's a number of different subtypes listed there. Communication disorders is one of them. And I think to a certain extent to say that it's this easy to segment the different areas and talk about them as discrete entities is perhaps not really realistic. I think the reality is that kids can have communication disorders without having other comorbid disorders or difficulties. The reality is that communication disorders often co-occur with lots of the other things that you'll see listed here as well. So again, I said at the beginning, I work with kids who have autism. They have lots of communication disorders. Their communication disorders are part of their diagnosis of autism, but they're an extra lens that we need to think about. Same with kids who have intellectual disabilities. They have cognitive challenges, and with that may come communication disorders. So again, to talk about communication disorders, in one way we can talk about them as sort of their own discrete entity. The reality is that there's tremendous overlap between the different categories, and we would need to have communication disorders in mind, even if we're talking about learning disorders or attention deficit hyperactivity disorder or motor disorders or autism spectrum disorder. So again, in the DSM-5, under the category though of communication disorders, what you will see is that there's sort of 5 different subtypes listed there. And we will go through and talk about each of them. I think the always interesting one there is the unspecified communication disorder, which is kind of the everything else category. And I'm sure, again, for those of you who know the DSM well, you'll know that there's kind of that always not otherwise specified or kind of catch-all category. So we'll talk perhaps more briefly about that particular one. I think language disorder is where I would like to put a lot of my emphasis today, just because it's something that's really relevant in lots of those different diagnostic categories and something that perhaps is less obvious than other categories like speech sound disorder or fluency disorder. So we can maybe talk about the parameters of language disorder in a way that people might not be as experienced with. So when I talk about language disorder, what I'm really talking about is spoken language disorder. So this is not looking at kids who have difficulties with reading and writing, but really we're just talking about oral use of language at this point in time. So I think if we're going to talk about language and the disorders that might happen with language, though, we have to understand first and foremost, some of the elements of language. And, like Heather said earlier, for sensory processing, when sensory processing happens very naturally and unconsciously for most of us, we're really not even aware that it's happening. And for kids who have autism or intellectual disabilities, often they look very physically unremarkable. And so when we think about language and whether their system is working or not working, we're not going to have those outward signs that tell us that there might be a problem. So if language is working fine, we take that for granted and on we go. But really the issue is when language isn't working fine, what are the things that we need to be thinking about, and what are some of the pieces that we might pick up on in terms of understanding what those difficulties are. And so to be able to do that, we have to think about language in terms of the 2 contexts that occur. That first and foremost, there's expressive language, which is the way that we would send a message to another person. And the flip side of that is receptive language, so how we as a communicator receive the message from another person. And it sounds, fairly simple to say, yep, there's receptive and there's expressive. But again, when communication disorders happen for kids, part of the investigation is to figure out whether those 2 sides of that same system are working equally as well or equally as impaired, or whether there's differences between them. And so we can't take anything for granted when we're talking about language, that again, there's a level of investigation that's required that goes beyond the obvious. In sort of taking that a little bit deeper and farther, what we want to think about too are what are the different pieces that make up language skills. So in linguistics, we talk about sort of 3 different types of language that you need to think about. There's the form of language, which includes things like the sounds of language, the phonology, the small grammatical pieces of our language that have meaning, and then those grammar rules, which is that conventional system that we've agreed upon as part of the language system. So it's how the language sort of takes its form and takes its shape that might be okay, or it might be impaired, and we need to know that that's a possibility. Then we can also look at content, or the meaning of language. So how do we encode meaning and how do we extract meaning from language? And that may be similarly impaired to form difficulties, or one area might be stronger than the other. And so we need to know that they're not all the same thing. And then there's also the way we use language, or the pragmatics of language. And what that really refers to is how language is used in different social contexts, what are the rules and sort of the ways that we use language conventionally to interact with other people. So we're going to revisit the form and the content and the use sort of as we go along and talk about communication disorders. But again, I just wanted to start you thinking about the fact that, again, language isn't as simple as the single word language sounds like it should be, that there's a lot of different sub-areas that we need to start thinking about that are the pieces that go into a fulsome language system. Now, if you look in the DSM-5, and we don't have to read through all of this sort of point by point because you can all read it here, or you can read it in the book. But in terms of a language disorder, I think what's important to highlight is that a language disorder really speaks to kids who are having that persistent or ongoing difficulties with some type or system within the language system. So whether it's that they're struggling to learn the words, whether it's the form of the language that they're having difficulty with, or whether it's how they're using language, those difficulties aren't just something that pop up and eventually go away, that this is really a persistent problem that's going to affect them over the long term. And what that problem looks like is that it is quantitatively different than kids who have adequate language systems. So there's going to be very functional limitations in terms of how they're able to use their language to interact and to receive messages from others. Certainly the onset is in the developmental period because that's when we're learning language. So we're not talking about acquired language disorders at this point in time, which might be things that happen to people's communication systems as they age or as a result of trauma or injury. We're talking about kids who, as they're growing and developing in their language skills, are struggling with something in the form, content, and or use of their language. Again, if we look at communication disorders as being their own separate entity, we would say that the language difficulties wouldn't be attributed to something else. So it's not that they're having difficulties learning language because they have a hearing impairment and they can't hear language, or they say in the DSM-5, again, an intellectual disability would sort of say, well, it's not a language impairment, because really what we would expect to see is that language abilities would be consistent with cognitive ability overall. But again, that's not to say that kids who have intellectual disabilities aren't going to have difficulties with language, and that's where I say those boundaries are a bit gray. And it's also not to say that kids who have an intellectual disability might not also have sort of a comorbid language difficulty or disorder. And so we can just keep those pieces in mind. But that we know that in terms of a diagnosis of a language disorder, you would want to be looking for things like history of parents reporting that kids are having trouble with language in some way, their milestones are delayed, they're not learning the way other kids are. Certainly in terms of observations, what do we see kids doing with their language and how are they responding to language? And then certainly there's lots of standardized language assessment protocols that exist that really allow us to measure a child's language against what we would expect for their developmental or chronological age. So we talked a little bit a while ago about the form, content, and use as the systems of language. And I'm going to save the phonology part till we get to the speech sound disorder section of the talk. But when I want to talk about in terms of what does a language disorder look like if you have difficulties with form, I'm focusing on what we call morphology and syntax. So morphology, when we use that as a linguistic term, talks about the smallest units of language that have meaning. So it might be the word cat is its own individual unit of meaning, but it also might be the little plural s that we put on the end of that. So cat, the s tells us that there's more than one. So that little s has its own representation of meaning. So the word cat is one morpheme, the word cats is two morphemes. So it's about how those little building blocks of language go together, and then how we use the rules of grammar to put words together in sentences that we can all understand and make sense of. And so kids who have difficulty with language learning in terms of their form, specifically morphology and syntax, some of the things that people are going to see as characteristics of that would be that kids are delayed perhaps in their acquisition of word combinations. So Lots of times I'll hear kids who have lots of single words, but they're not yet putting their words together into multi-word phrases or sentences, that they might be delayed in combining words in those ways. For little kids, we would talk about them having a restricted mean length of utterance. That refers to the number of morphemes that they're using in their utterances. And as kids get older, we really just start talking about counting words as sort of units of measurement. And what we'll see for kids with language disorders, again, is that they use fewer morphemes and they use fewer words. So their phrases are shorter and simpler. They also will use grammatical errors. So we might see things like incorrect verb tenses. They're not using those little function words that we use to enrich sentences like the and the. They're leaving those things out. They might not be using pronouns like he and she and they correctly. They might be mixing those things up. Lots of difficulties understanding what those little grammatical pieces of language mean. Kids with language disorders are really not very good at figuring out whether languages or whether sentences are grammatically correct or not. So I was having a conversation with a girl the other day who was 10 years old. She should be at an age where she's kind of got her verbs and her verb knowledges. And she kept telling me that she brang something, and she probably used it about 3 times, which would not be the correct sort of past tense of the word to bring, which would be brought. I brought something. But for her, she showed no awareness of the fact that that wasn't the correct word or that that sentence was grammatically incorrect. And so you can see that they're not good at monitoring even the sound of their own language. Lots of difficulties for these kids in terms of understanding sentences as they get longer and more complex, when we start putting clauses into sentences and there's kind of pieces of information embedded within other pieces of information. Our kids with language disorders really struggle there, and then they have lots of difficulties creating stories and putting strings of language together and really coordinating language at a much more long or complex level. So some of those are the red flags, again, that you'll see for kids who have language disorders in terms of their form. And in terms of their semantics or their meaning, some of the things that you'll see there is that our kids with language disorders will be very slow and maybe late to develop words at all. Their vocabulary acquisition is behind where we would expect it to be. They may have difficulties learning different types of words, so they might start to get some nouns and be able to label the things in their environment, but those words that are a little bit more abstract, things like verbs and pronouns, are harder and slower to come. They may have difficulties for typically developing kids, especially in the preschool period. As I'm sure you all know, there's a little explosion of language that happens, and that happens because for most kids they have skills of what we call fast mapping, which is basically they hear a word, they see its referent, and they learn it. But for our kids who have a language disorder, they may not have that sort of automatic language processing and learning. It may take them many more exposures to words before that word starts to become part of their vocabulary. They'll have lots of difficulties understanding new words, and a lot of difficulties finding the words when they need them. So being able to think of the words that they need when they're trying to give a message to another person. As a result of those word finding difficulties, what we'll often find with our language disordered kids who have difficulties in this area is that they'll use a lot of filler words. So you'll hear lots of and have lots of pauses and repetitions. So if you're hearing things like that, that might be a red flag for you that the kids are having trouble with their words and their word meanings in sentences. Certainly they would have difficulties then understanding the words, especially as sentences change. So understanding questions and directions when there's lots of words and they're all very important to understanding the message, that's tough. And then taking the understanding of language to the next level. So for our kids with language disorders, they may struggle just to understand words, but then when you start using figurative expressions and idioms and times when language actually means something different than what those individual words mean, then our kids with language disorders get really lost. So if I say it's raining cats and dogs out there, most of us know that means it's raining really hard. Our kids with autism really aren't quite sure of what that means because there are no cats and dogs falling from the sky. Our kids with semantic difficulties may have difficulties paraphrasing or understanding the language that they've heard and then being able to put it into their own words, and a lot of difficulties also understanding stories. Stories have a lot of words, And those words and stories are all connected with one another in some meaningful way. And if you're really struggling to understand just the words themselves, then understanding how all of those words go together is going to be really, really difficult for our kids with language disorders. And then I'm going to talk about problems with use of language when we talk about social communication disorders. So hang on to that one. I think in terms of red flags, and again, things that we want to take note of for, considering the possibility of communication disorders for kids. And again, these are communication disorders for kids who may exist in isolation. So language and communication is going to be the only difficulty that they have. But also in terms of how kids with intellectual or developmental disabilities are also developing in their language skills. So the developmental milestones that we would be looking for really are not qualitatively different then we would be looking across different categories. So things that we'd want to be taking note of is what they're doing at different ages. So by 9 months, these kids are the kids that should start to know that the name of the word of their name has specific meaning to them. They're responding to their name. They're starting to use gestures, which is a form or a symbol, if you will, of communication, and understanding that symbols have meaning. They're starting to use sounds in a way that they're used on purpose. That's where we hear the baba and the mama, but they're using them in ways that they actually have communicative intent. By 12 months, we're expecting our kids to be using their first words, that's the age at which they should be starting to use those single, milk, dog, cup, cow, those sorts of things. As kids get a little bit older, by 18 months, they should be using at least 20 words. Most of those at that point in time will be nouns. They should be starting to understand questions, simple questions. And if we're not seeing kids being able to do that at these ages, we're starting to be concerned. By, as you can see as we go along here, by 18 to 24 months, they should have a vocabulary of at least 50 words. And at that point in time, when kids have a vocabulary of about 50 words, we would expect them to start combining the words into two-word sentences. So we would want to be looking first and foremost to make sure kids actually have that quantity of words, but if they do have that quantity of words, to make sure that they're actually starting to combine them the way they should be. And you can read the rest of the developmental milestones that are up there. But again, I think they're really important for us as markers to monitor what kids are doing and when they're doing it, because it's really going to let us know whether their communication and language systems are developing in a way that we would expect them to. In terms of, just interesting facts and risk factors, I think that there's a lot that we can look at in terms of language disorders, and so I've just picked a couple here that we can have. I think what's important to note is that there may be some slight differences in terms of when boys and girls acquire language. I think people often will say, oh, it's okay, he's a boy, he develops language, it's okay, wait and see. He might be a little bit later because he's a boy. But the reality is that all kids actually should develop their language skills within an average time frame. So the difference between boys and girls in terms of language acquisition really should be quite small. That perhaps girls will acquire language skills towards the end or the beginning of the average range, and boys might be a little bit closer to the end of the average range. But the reality is that kids should be developing their language skills within sort of that milestone checklist that I showed you earlier. And if there's not, or if they're not, then there's probably a problem. And so that's where you would want to start taking note of that. And I think that historically there's sort of been a, well, wait and see approach. And I think what all of the preschool speech and language programs would tell you at this point in time is don't take a wait and see approach. That if you're seeing kids are not meeting their developmental milestones, it's time to have them seen by somebody. And that somebody may be a speech path, that somebody may be the family doctor, it may be a pediatrician. I think other things just for us to take note of and to be aware of in terms of language and communication disorders is that there does tend to be a greater risk in boys than girls, depending on the stats that you look at. There's either a 2-to-1 or a 3-to-1 difference there. So boys, again, we want to be watching that twins, especially boy twins, are at a slightly greater risk of having language disorders. That only about 40 to 50% of kids who are late talkers. So some kids will be late in their acquisition of vocabulary and language skills. And again, that whole wait and see approach, I think, is based on the fact that sometimes kids do sort of have that little burst and catch up. But what the literature tells us now is that really only about 40 to 50% of those late talking kids will catch up on their own. And again, so it's pretty important for that 50 to 60% of kids who aren't going to catch up to be directed into some sort of intervention and identified in some way. And again, it sort of speaks back to that, let's not take a wait and see approach with these kids. Because we don't know which are the ones that are going to catch up and which are the ones that aren't. We don't have sort of any markers that tell us which group of kids each one will fall into. And then I think the other thing for us to take note of is that kids who are learning more than one language at a time, what the research suggests at this point in time is that having an extra language doesn't necessarily compound a language problem, but that they're likely to have similar difficulties in both languages. Okay. Dr. Nicholson and I have had a few conversations about that one. That's why I'm smiling, because I'm looking at him. Okay, so I think, we can talk lots about a language disorder and we can hear about it, but I think there's really nothing quite like seeing it. And so I have this little video clip, my fingers are crossed that it will work. And I think, this is a fascinating little girl, because at the end I'm going to ask you a question and we'll see what you can answer.
Hey.
Hey.
How you doing today?
Good.
What's your name?
Aubrey.
What grade are you in?
3rd.
How old are you?
8.
So, what book did you just read?
Author's Lost Tooth.
Was it a good book?
Yes.
You want to tell me about that book?
Yes. Well, most of the things like that, author's first tooth, he wanted to come out, and then it's Sister Violet. It's scared of the dark. She's scared of the dark, and she came, and then she yanked the doorknob, right on the doorknob, and he pulled, and then the babysitter came, and it came out, and then it was a good book. And they had marshmallows, s'mores, top out. That's it.
Okay. You enjoyed the book?
Yup.
Okay.
Are we done?
So my question to ask anybody is, would anybody like to put up their hand and paraphrase what Arthur's Lost Tooth is about? No, right? We have no idea what Arthur's Lost Tooth is really about in terms of the story that happened. But what I like about this clip is that you see so many things that this girl actually can do well. So her speech is good. She sounds good. We're not hearing any difficulties with sort of her sound or her intelligibility. She's using lots of non-verbal forms of communication nicely. In fact, I think she's using those things to compensate for some of the difficulties that she's having, right? How old is she? She's 8, and she holds up her fingers. But if you notice, and I won't play it again for the sake of time, but those fingers go up before the word 8 comes out of her mouth. And I think that not only buys her time, but it probably also cues herself a little bit to help her find those words. That her pronouns, if you listen really carefully, they're changing. So you're hearing he, she, it, and you're not really quite sure who she's talking about. But it looks like she should be able to tell us that story. And again, she's got words, but the words aren't quite the words that give us any meaning. And so, I think seeing what that looks like in real life is a little bit helpful in terms of thinking about what does a language disorder look like. I think language disorders are interesting, so I've put up a couple slides here of just interesting things for you to know. That overall, language disorders affect about 7% of kids. So it's certainly not an uncommon difficulty that exists out there. And what we know also is that language disorders are highly heritable. That this particular quote taken from the Canadian Association of Speech Language Pathologists suggests that up to 20 to 40% of kids who have a language disorder will have some incidence of specific language impairment also in their family. The DSM-5 no longer separates communication disorders or language disorders in terms of that receptive or expressive component. I think the ICD-10 still does look at that difference. But important to know and to think about is that we know that kids who have expressive language disorders, but their receptive skills are better or okay, actually have a better prognosis. It's the kids who have really impaired receptive or understanding of language skills that are going to have greater difficulties, and those difficulties are more likely to exist for them throughout their lifetime. And so we want to know, again, that difference between the expressive and receptive skills. We know that kids who have stronger vocabulary skills upon entering school are going to do better in terms of their academic performance. That early vocabulary marker is a strong sign in terms of their linguistic ability. We know that though language disorders can look different across the lifespan. So kids might look okay in their early years, they might be okay with their words and things like that, but as the curriculum and the demands of school start to become more complex, more abstract, and they have to use language in perhaps other ways for learning rather than just simply learning the language, that's where we're going to start to see the difficulties. So we can't say that a child who's in kindergarten and doing fine isn't going to be the child who's going to be flagged in grade 3 or 4 as having something look not quite right. And that we know that oral language difficulties, and that's what we're talking about right now, are though closely associated with reading and writing difficulties. So again, in terms of academic implications and life skills, that we want to certainly be aware of those, and certainly providing remediation because there's going to be farther reaching effects of a language disorder. Other things that I think are interesting and I just think you should know is that there is quite a high co-occurrence of language disorders among psychiatric disorders, and some of the estimates, this one's taken from the American Speech and Language Association website, would suggest up to 40% of kids who have a psychiatric disorder also have a language disorder. That we do see that language disorders are not sort of the same across the board, that we do see that there are certain populations that are more likely to have language disorders or perhaps more susceptible, and that may tie in with the heritability component that we've talked about earlier. But I think what I find very interesting, probably because of where I work and my exposure to a lot of kids who have significant problem behaviors, is the social and emotional implications that language disorders can have for our kids. And that really they're going to implicate our kids not only in terms of their language, their communication, perhaps their academics, but the social opportunities that exist for them and the emotional regulation skills that they have. Again, a lot of us use language at times when we're dysregulated or overwhelmed. Either somebody talks to us and they provide more explanation, or they help us to calm through counseling. For kids who have language impairments, using language to help us cope at that point in time probably isn't a particularly helpful strategy. And so we so often see problem behavior at times because our kids don't have the communication skills to tell us that something's going wrong, and they can't benefit from language-based strategies to help them in those moments of dysregulation. So I think, again, the impact of language disorders can be very, very significant, not only in terms of the words and the grammar, but I think in much more far-reaching areas than probably ever would first come to mind. In terms of red flags and when would a physician really want to be concerned about language development, I think it's fairly simple in some ways, is that if kids aren't meeting their milestones, quite frankly, if parents are concerned, if parents are saying something's not right here, my child can't understand, my child can't tell us what they need or want, that really, again, the preschool speech and language programs exist because we are trying to work away from that wait and see approach. Let's get kids looked at instead. Or again, as kids get older, if we're starting to see behavior problems and things like that, kids are struggling in school and we're not really sure why, those are the times when language would need to be considered. In terms of who to call, I think first and foremost, we do want to make sure kids have hearing assessments because we want to make sure that they're actually receiving language and that that's not the barrier, the issue that's causing a complication. And then in Ontario, we're very lucky. We have quite a rich preschool speech and language program, and really they are always advocating to get kids in as early as possible. So again, the first time people start to be concerned, they're recommending people make referrals. Once kids get to be school age, the school board speech language pathologists would be your resource. Or there's private practice speech paths as well. Okay, So that's the kind of the bulk of what I want to say. We're going to buzz through the other areas. I'm kind of watching time here, and I know we're a bit restricted. But I think the language piece is important, and perhaps, like I said earlier, the one that is less obvious, sort of at first glance. Speech sound disorder, really speech production. Speech production is interesting because it's a very complex process. It requires us to move a lot of different parts of our body in very coordinated and quick ways. And it really requires sort of that coordination to happen not only within sort of the musculature of the structures, but the signals of the brain that get those structures moving. And so there's a lot to speech production. But again, when it happens naturally for most of us, we kind of take it for granted. It's all very easy. But for kids who have difficulties getting those articulators to move and sequencing those articulators, making the sounds that we need to use spoken language can be very, very difficult. What you'll see coming up is I've got a couple slides. Like language development, there's milestones that we're looking for. Kids develop different sounds at different times. And so we would want to be monitoring that. But again, overall, by the age of about 3, our rule of thumb is that kids should be about 90% intelligible to an unfamiliar listener. So again, what we see is there's a lot of development that happens in those first 3 years, whether it's a child who has speech disorder in isolation, or whether it's a child who's having difficulties making speech sounds because something else is going on. We want to be alert to those red flags. So there's a couple different charts in here. What you'll look at is if you compare the 2 charts that are in here for you, there's a little bit of variability, and I think it just depends on the study that's done. But we know that some sounds are very early sounds, so we're expecting the puzz and the n's and the buzz to come out early, and those r's and th sounds are going to come out later. So I'm not worried if a child that I see who's 3 doesn't make th's. I am pretty worried if a child that I see who's 3 isn't making a b sound. That's pretty concerning for me. And so it's important, I think, just to have a sense of what is developmentally appropriate for speech sound acquisition. This one's from the Toronto School Board. I think it's colorful and cute, so I included it for you. In terms of speech sound disorder, again, what we know, which is written is that speech sound production is considered a problem when it interferes with the communication of a message. So when there's a disturbance in sort of the effective communication of a message, and that difficulty is identified in the earlier developmental period. Again, we would consider for a pure speech sound disorder that would be in isolation of difficulties in other areas. But I think that, certainly we can have kids who have language disorders or cerebral palsy who are going to have difficulties with speech as well. So just recognizing that while the speech difficulties may not be attributable, they may co-occur. Speech sound problems, really overall in a nutshell, are about delays in the acquisition of speech sounds. So the overall intelligibility of a child's message as a result is compromised. It's hard for people to understand what kids are saying. Often in speech sound problems, it's that kids are developmentally behind where they should be. And so we see them doing things like using simpler syllable structures. They're using just consonants or just vowels, and they're not always putting those together in ways that we would expect. They might be doing things like making one sound more like another sound in a word, leaving sounds out, leaving parts of words out to make it easier in terms of how they're able to express themselves verbally. There's 2 different areas to think about in terms of speech sound disorders, I think. One is just those kids who are delayed in their acquisition of speech sounds and they're behind where they would expect to be. There's another area of speech sound difficulties that we call apraxia of speech, and that's a more neurological impairment of kids and neurologically getting the signals from the brain to the articulators in the way that they need to happen to be able to create speech. The end result of both, and again, I think what we want to have in mind at this point in time, is that both areas would have very significant implications for kids in terms of their ability to send intelligible messages to others. The difference between the 2 certainly would be, though, that there would be a different intervention approach. So a speech-language pathologist would be able to guide you in terms of looking at what are the differences between articulation or phonological problems and an apraxia of speech. And just to give you a little clip of what that might sound like, I'm going to play this little cutie pie here.
Now you can say it. And what did you say about her hair? Does she have it in a ponytail or down? A ponytail? What is your hair like?
Down.
Tell Miss Lacey about what different schools you go to. Speech. And where else? What's your other school called? Miss Shannon and Miss Vicky's school. And what do you do there? What do you do at that school? At Miss Vicky's school, Miss Shannon's school?
Play.
You play?
We.
You swing?
It
It doesn't have a swing. What does it have? Sit down. It has monkey bars. Can you say monkey bars? Yes. Do it one time. Get your sock out of your face. Say monkey. Say look. Say monkey. Say key. Monkey. Oh, that's close. It's taken too long. Okay. What's your favorite thing to do at home? Play Wii. Tell me all the games you play. Why I do my eye like that? I had something in it. Tell me what games you play on Wii.
Okay, so I'm going to stop her there because I think that gives you an idea. It's really tough to understand what she's saying. And as an unfamiliar listener for this little girl, I basically have no idea what she's saying. And then when her mom says it afterwards, you go, oh, okay, yeah, that's probably what it did sound like. I think what's neat about phonological disorders, though, is that it's a pattern of speech production errors. And so often what you'll see is that moms and dads are more able than unfamiliar listeners to understand these kids because they learn their child's pattern of speech. And so sometimes they may not even report the difficulties to be as significant as they are because they've learned to compensate for that in their interactions with their kids. But certainly huge implications in terms of this little girl's opportunities to share messages with other people. And again, that can spread to other areas. So social opportunities for other kids, I don't know what she is, maybe 3 years old, who are 3 years old who want to play with her. She's going to be a lot of work to play with because you have no idea what she's saying. And other kids are probably going to go find kids who are easier to play with and talk to. And so her social opportunities may be compromised as a result. So you see those branches or the implications of a speech sound disorder, perhaps again, reaching out a little further than you might first think. We're just going to buzz through the other two areas, but before we move on, again, concerns about speech sound development are very similar in terms of language development. That if you're seeing concerns, if they're not matching up with their milestones, certainly we would want to make sure that they're seen by a speech language pathologist who could help look at what's going on. And prior to sending them to a speech path, again, we'd want to make sure that their hearing was assessed and that wasn't part of the problem. Child onset fluency disorder, also known as stuttering, is a much more obvious communication disorder, and I think the implications of this may be about transmission of the message, but also have huge psychological and social impacts for kids who have this type of communication disorder. So just again, fluency disorders occur when what we don't have is sort of that fluid, smooth flow of speech, when that's impaired or something gets in the way of that transmission of messages. What we know about fluency, though, is that it does have a sort of a typical period in development. There is a period of dysfluency that can occur. So for girls, it's kind of between that second and third year, and for boys, it may be even between the third and fourth year. And that many children who do show those early developmental dysfluencies do eventually outgrow those dysfluencies, but there is also a proportion of kids that don't outgrow that. And again, there's going to be implications for them. So I'm just going to show you a real quick video. It has a little opening, and then it gets on to the kids here.
My name is Schulich. My friends and I made this video about stuttering. Hey, you should meet them.
Hi, my name is Kate. I play travel soccer and I love to play with my family. I stutter. My name is Daniel. I am 7. I have 7 fish. I like to collect rocks and I stutter.
Hi, my name is Matthew. I love to play baseball. I have a broken thumb. I love to play with my friends, and I stutter.
Okay, so that just gives you a little snapshot, and I think when you see stuttering, you know stuttering. But again, I think what's important for people to have on their radar in terms of typical development is that there is that natural period of disfluency that does occur for some kids, and that only some will continue on past that and become sort of stutterers in their lifetime. What's interesting about disfluency is, like lots of other things, is that we still don't really know what causes it, that there is believed to be some sort of genetic influence, and we know that there are risk factors that you can read up there. What we know about intervention for fluency at this point in time, though, is that it's really primarily a behavioral type intervention that is applied, and it's helping kids learn to modulate their speech and think about how they produce speech in a way that most of us don't have to. There's some tips there for speaking with somebody who stutters, and you can read through those. But really, again, in terms of red flags and concerns for disfluency, I think when you see it, there's obviously reason to be concerned. You would want to monitor that over a period of time. And if it persisted past about a 6-month period, that's where, again, you started to see what we would call secondary characteristics, so facial grimaces and different movements of the body. That's where you would probably want to have it assessed by a speech-language pathologist. So again, you could refer to the preschool speech and language program, or if the kids are school age at that point in time, you would refer to the school speech path, who would then probably refer on to school health support services. The last area that I just want to hit on, and we're just going to buzz by it faster than I'd like to, is social or pragmatic communication disorder. And that is really about that last, if you remember, we talked about the 3 areas, form, content, and use of language. It's about the use. So it's about how kids are using language or other forms of communication, so nonverbal forms of communication, to interact with others, and whether they're doing that in the ways that would be expected based on their social contexts and environments. So in the DSM-5, there are diagnostic criteria for social communication disorder that includes things like not using communication that's appropriate to the social context, not matching it to their listener, not being able to sort of follow the rules of conversation, turn taking, those sorts of things. And you can read through those. I think what we know is that social communication disorder can affect lots of different areas. So it's sort of a vague area in terms of pinning it down and saying really what is social communication disorder, but there's lots of different places where kids can have difficulties in terms of social communication. What we would want to do in terms of this diagnosis is to certainly look at differential diagnostics in terms of, is there an autism spectrum disorder that perhaps is contributing, ADHD, intellectual disability, anxiety. And what is also important for people to have on their radar is to know that often these social communication difficulties don't really start to show up until kids are required to participate in sort of structured social communication contexts. So once they reach school and they have to do things in a way that they never had to in preschool. So we might see kids more likely to be referred for social communication difficulties once they reach school age. Unspecified communication disorder, like I said earlier, is kind of a catch-all, and you can read here what the DSM-5 says about it. Basically, if you see something that you're not sure about, but it doesn't quite meet the diagnostic category of those other 4 things that we've talked about, then that's where that would be appropriate. Communication disorders are really pretty common. And we talked about language disorders affecting, we said about 7% on the slide that I showed you earlier. Anywhere from 5 to 10 is what you'll read in the literature. Articulation disorders affecting 2 to 3% of the population. Fluency disorders affecting 1% of the population. And again, those social communication disorders, because they're still somewhat undefined for us, we don't really have a prevalence estimate. It's a little bit harder to pin it down. But that's a lot of kids. I think what's represented in those statistics is that there's a lot of kids who are affected by a communication disorder. I think there's also things that we need to think about is, again, there's lots of different reasons why kids can experience developmental problems with communication. So like we said earlier, whether those are problems that happen in isolation or whether they are problems that co-occur with other diagnoses or symptoms, But important for us to note, I think, that communication disorders are often those first red flags that are noted. And so speech language pathologists or family doctors are the ones who are receiving the concerns from parents about communication problems. And I think that can be a springboard to investigation about lots of other things, that they do occur in isolation or as part of other conditions. And again, I think, you know, a speech path can help to sort out the flavor of that and to pull in other resources as needed. That's the end of my slide. Thanks.